Dr. Coleman. I'm Dr. Green.
Nice to meet you.
You too.
Okay, can you tell me a little bit about yourself?
Sure. I just graduated, I think, of college with my DPT. And I kind of just want to jump into neuro rehab. I'm real motivated. All those people sometimes aren't, the most motivated because they might not see their prognosis very well, but I want to be there to really get them to the next level. I'm very, just go right at it and jump in. And I think a lot of the time that's what neuro patients need. They need that upbeat person, that person who, gives 100% towards their care, and I think I can really be that person for them. So I think Jarmel is a pretty good fit for me.
Yeah, that sounds great. Can you tell me just some of your strengths and weaknesses?
Sure. I'd say strength-wise, like I had said, very motivated. I'm always about the patient, always put them first. I can take my lunch breaks whenever I can fit them in. I don't need to, bounce around and talk to everybody in the office. I have my patients, and I love to stay with them and, build relationships aside from just therapy. So I want to be there. If they have a problem that has nothing to be related to neuro PT, I want to be there for them, more than just a PT. Not necessarily a friend, because we still have to keep that professional level, but, just anything they really need to talk about, even they can come to me with. So I think that's kind of, one of my strengths. As far as weaknesses go, I think that's kind of a double-edged sword, because at times it can be burdensome, with notes or things I'm getting behind on because I'm spending maybe too much time with the patients could potentially cause some conflict. But I think that's very adjustable. I can
that's definitely something that can be worked on, I'm sure.
Right.
Yeah.
So I would think it's kind of a good fault to have.
Yeah.
But that being said, it does take some time away from billing or patients or other people who aren't necessarily my patients.
But, So what makes you interested in this job?
I've always had a thing for neurological rehab. It's so in-depth and so involved that it's always changing. So you might have a CVA patient who needs this amount of rehab for his specific conditions, and then you can have the same exact injury that's a completely different treatment. Mm-hmm. And that's what I like. I like being creative, using my mind to create treatment things that maybe aren't conventional, new things, just to see if they work, because really I feel that with neuro patients, there's kind of a billion different ways to go. It's not set in stone. There's so many different cases. There's so many different ways to treat. Mm-hmm. And I look forward to the opportunity of working with you. 30 years experience kind of is a solid backbone that, as me being a new grad, I can base my treatment methods off of, or try something new with you and your patients and see the outcome versus something that's traditional.
Yeah, that sounds great. You sound like you really have a passion for it already, which is
nice.
nice.
Absolutely.
Do you have any experience in the neurological field?
I do. I was at a clinical this past summer that had a fair dose of neuro patients, CVAs, some TBIs, and I actually, before even college, I had worked at an outpatient facility where there were, multiple TBI patients who didn't necessarily receive the care they needed, and it bothered me when I saw that. They have one therapist trying to move, manipulate or move around a C5 patient, C5 and below a quadriplegic, and he can't do it. So the patient's not getting the best care. And it kind of just drove me to wanting to do something about it, and working in a rehab facility provides me with that opportunity.
Yeah, definitely.
There's endless ways, and multiple people helping the same patient, where a real, comprehensive rehab, like, your facility is run, makes me want to even help these people more than I can. That's
great to hear.
So,
Okay. Where do you see yourself in 5 years?
I definitely want to get a solid base of neuro rehab. I think I will stay in that field for a long time. Like I said, it's always changing. Yeah. And I'm somebody who, I can't be stuck in one rut for too long. Yeah. So I'm always up and doing something and, changing. Mm-hmm. And I think neuro is the perfect place for that, just because there's so many different things.
And it's so different with everyone.
TBI to Parkinson's is completely different. And then the approaches are two separate things. So I think staying in one spot, and that also gives me the opportunity to follow patients, because neuro isn't necessarily a 4-week thing like an orthopedic injury is. Yeah. You have 12 weeks of rehab per patient at minimum, which is what you guys strive for. Kind of, makes me want to stay. Even, just want to be there, want to follow my patients all the way through as far as I can to, maybe even work on an integration program back into their home or back into their job. Because a lot of the times, once therapy ends in the office, these people are left on their own, which it just isn't fair. So I figure moving in here, after I get a solid base of knowledge, possibly integrating programs into rehab and at your facility to, provide these people with some outside of the office, ways to reestablish into work or to home or to even driving their car. Yeah. So.
Okay, that sounds like a great plan. Yeah.
Yeah.
Okay. So, do you have any questions for me?
Yeah, I guess what I really want to know is how closely you guys are established with an inpatient clinic, so that you can. When do I get to start seeing the patients, in other words? So are we seeing them, 12 weeks post-injury, or is this 3 years down the road, typically speaking?
Typically, we're seeing them after they've left the inpatient facility, but there are obviously a limited amount of neurological inpatient and outpatients, so we have a pretty steady stream of patients. Depending on the severity of their accident, will depend on how soon we see them.
So most of the neuro patients around kind of go to you. Okay, yeah, that's perfect. The more the better.
Yeah,
as always.
Definitely.
So. All right, I think I'm all set.
Okay, it was very nice to meet you.
You too. Thank you.
Yeah.